Welcome to the CMA Full Practice Test 1. This quiz contains 100 questions to help you prepare for the CMA Full exam. Let's get started. Question 1. A patient's account shows an outstanding balance of $250 for services rendered 90 days ago. 2 previous statements have been sent with no response. According to standard patient billing collection procedures, which action should the medical assistant take at this stage? Option A. Discharge the patient from the practice for non-payment of the balance. Option B. Make a follow-up phone call to the patient to discuss the balance and payment options. Option C. File a small claims lawsuit against the patient for the outstanding amount. Option D. Immediately send the account to a third-party collection agency. The correct answer is B. Standard patient collection procedures follow a graduated approach. After 60 to 90 days with no response to statements, a personal follow-up phone call is appropriate to discuss payment options, identify potential financial hardship, and offer payment plans before escalating to more aggressive collection measures. This maintains the patient relationship and often resolves outstanding balances. Question 2. A medical assistant is supporting a patient who has just received a new diagnosis of type 2 diabetes. The patient says, "I don't know if I can handle all these changes. What if I fail?" Which response demonstrates the MA's role in shared decision-making support? Option A. You'll need to follow the doctor's instructions exactly, or your diabetes will get worse. Option B. Many patients manage diabetes successfully. Would you like to discuss what changes feel most manageable for you to start with? Option C. Don't worry, diabetes is easy to manage once you get used to it. Option D. The doctor will decide your treatment plan. You just need to follow it. The correct answer is B. The medical assistant's role in shared decision-making support includes providing encouragement, exploring patient preferences, and helping identify manageable starting points. This approach respects patient autonomy and supports collaborative decision-making between patient and provider. Question 3. Which of the following is not one of the 6 rights of medication administration? Option A. Right patient. Option B. Right time. Option C. Right diagnosis. Option D. Right documentation. The correct answer is C. The 6 rights of medication administration are right patient, right drug, right dose, right route, right time, and right documentation. Right diagnosis is not included because the medical assistant does not diagnose. They verify the medication order matches what is prescribed and administer accordingly. Question 4. A physical therapist calls the clinic requesting information about a patient's recent knee X-ray results before the next therapy session. The medical assistant answers the phone. Which interprofessional communication response is most appropriate? Option A. Please have the patient request the records, and we'll send them to her directly. Option B. The patient needs to authorize release of records to your facility first. Option C. Let me verify you're a treating provider, then I can share relevant findings for treatment. Option D. I'll fax the full radiology report to your office right away. The correct answer is C. HIPAA permits disclosure of PHI to other healthcare providers for treatment purposes without patient authorization. However, the medical assistant should verify the identity of the requesting provider before sharing information. Once verified as a treating provider involved in the patient's care, relevant clinical information can be shared to facilitate treatment coordination. Question 5. A patient requests copies of her medical records from a recent hospital stay. The medical assistant explains that the original medical records belong to the healthcare facility, but the patient has rights regarding access. Which statement accurately describes medical record ownership? Option A. The patient owns the original medical records and can take them home. Option B. Medical records have no ownership and are public property. Option C. The physician who created the records owns them exclusively. Option D. The healthcare facility owns the physical records, but the patient has the right to access and receive copies. The correct answer is D. Medical records are owned by the healthcare facility or provider that created them. However, patients have legal rights to access their records, request copies, and request amendments under HIPAA. The patient owns the information, but the facility owns the physical documentation. Question 6. A medical assistant receives a phone call from an attorney requesting copies of a patient's complete medical records for an ongoing legal case. The attorney states the patient has authorized the release. Which action should the medical assistant take first? Option A. Refuse to release any records since attorneys cannot request patient information. Option B. Ask the attorney to provide a verbal summary of the case before deciding to release records. Option C. Immediately fax all requested records to the attorney's office. Option D. Verify that a valid written authorization form signed by the patient has been received before releasing any records. The correct answer is D. Release of information, ROI, for purposes other than treatment, payment, or healthcare operations requires a valid written authorization signed by the patient or their legal representative. Verbal claims of authorization are insufficient. The medical assistant must verify receipt of a properly completed authorization form that includes required elements, patient identification, specific information to be released, recipient, expiration date, and patient signature, before processing any request. Question 7. A medical assistant is counseling a patient who wants to start taking St. John's wort for depression. Which information is most important for the medical assistant to include in patient education? Option A. St. John's wort is regulated by the FDA the same way prescription medications are, so dosage is standardized. Option B. St. John's wort may interact with many prescription medications including antidepressants, birth control pills, and blood thinners, so the patient must inform the provider before starting. Option C. St. John's wort is completely safe because it is a natural herbal supplement. Option D. St. John's wort has been proven to cure depression completely without any side effects. The correct answer is B. St. John's wort, Hypericum perforatum, is a commonly used herbal supplement for mood, but it has significant drug interactions. It can reduce the effectiveness of antidepressants, risking serotonin syndrome if combined, decrease birth control pill efficacy, and interact with anticoagulants like warfarin. The medical assistant must educate patients to inform their provider before starting any herbal supplement to avoid dangerous interactions. This is within the CMA scope of patient education. Question 8. A medical assistant discovers that an autoclave load of surgical instruments was run at 250 degrees Fahrenheit for 20 minutes instead of the required 250 degrees Fahrenheit for 30 minutes. The instruments were already distributed to exam rooms. What is the appropriate response to this near-miss safety event? Option A. Use the instruments for non-invasive procedures only since some sterilization occurred. Option B. Document the error in the maintenance log and continue using the instruments. Option C. Retrieve the instruments and reprocess them through a full sterilization cycle. Option D. Report the incident through the Patient Safety Variance Reporting System. The correct answer is C. Autoclave sterilization requires specific time-temperature combinations to achieve sterility. Running a load at insufficient time means sterilization was not verified and instruments may not be sterile. The instruments must be immediately retrieved and reprocessed through a complete sterilization cycle before any clinical use. This is a quality and safety near miss that should also be reported. Question 9. A medical assistant witnesses a colleague making inappropriate comments about a patient's appearance and touching the patient's shoulder in a manner that makes the patient uncomfortable. The patient later confides to the MA that she felt harassed. Which action should the medical assistant take? Option A. Ignore the situation because the colleague's actions were not physically harmful. Option B. Wait to see if the patient files a formal complaint before taking action. Option C. Advise the patient to handle the situation directly with the colleague. Option D. Report the incident through the facility's harassment and discrimination reporting procedures. The correct answer is D. Workplace harassment and inappropriate patient interactions must be reported through facility reporting procedures. Medical assistants have an ethical and often legal obligation to report observed harassment, discrimination, or inappropriate conduct. Facilities have policies and procedures for investigating and addressing such complaints to protect patients and maintain professional standards. Question 10. A comprehensive communication assessment is being conducted for a patient who is anxious, has limited English proficiency, and needs education about a new chronic condition. Which combination of communication strategies should the medical assistant prioritize? Option A. Use a professional interpreter, apply teach-back method, employ therapeutic communication for anxiety, and use plain language. Option B. Use medical terminology for accuracy, speak quickly to save time, and provide written materials only. Option C. Assume nodding means understanding, skip the interpreter to build rapport, and focus only on medical facts. Option D. Ask the patient's family member to translate, avoid discussing anxiety, and provide complex written instructions. The correct answer is A. A comprehensive communication approach for complex patient needs combines multiple strategies: professional interpreter for accurate translation, teach-back for comprehension verification, therapeutic communication to address anxiety, and plain language for accessibility. This multi-layered approach addresses all barriers simultaneously. Question 11. A fire breaks out in a supply closet in the medical office. The fire appears to be confined to wastebasket materials. Which fire extinguisher technique should the medical assistant use? Option A. Pull the pin, aim at the base of the fire, squeeze the handle, sweep side to side. Option B. Throw the extinguisher into the center of the fire. Option C. Aim at the base and squeeze continuously in one spot. Option D. Aim at the top of the flames and sweep upward. The correct answer is A. The pass technique, pull, aim, squeeze, sweep, is the correct method for using a fire extinguisher. Aiming at the base of the fire targets the fuel source rather than the flames above. Sweeping side to side distributes the extinguishing agent across the entire fire base for effective coverage. Question 12. A medical assistant is performing pulmonary function testing using a spirometer. The patient is instructed to take a deep breath and exhale as forcefully and completely as possible. Which measurement is being assessed with this maneuver? Option A. Peak expiratory flow rate, PFAR. Option B. Tidal volume. Option C. Residual volume. Option D. Forced vital capacity, FVC. The correct answer is D. Forced vital capacity, FVC, is the total volume of air that can be forcibly exhaled after taking a maximal inspiration. This is measured during spirometry by having the patient take a deep breath in, then exhale as hard and fast as possible until no more air can be expelled. FVC is a key measure for diagnosing obstructive and restrictive lung diseases. Question 13. A medical assistant applies a Holter monitor to a patient for 24-hour cardiac monitoring. Which instruction should the assistant provide regarding the patient activity diary? Option A. Record all activities including sleeping, eating, walking, and any symptoms. Option B. Record activities only when the monitor beeps or displays an alert. Option C. Record activities only when experiencing chest pain or palpitations. Option D. Record activities only during waking hours when physically active. The correct answer is A. A Holter monitor patient diary must include comprehensive documentation of all activities throughout the 24-hour monitoring period, including sleep, meals, physical activities, emotional stress, and any symptoms such as chest pain, palpitations, dizziness, or shortness of breath. This complete record allows the provider to correlate heart rhythm changes with specific activities and symptoms for accurate diagnosis. Question 14. A medical assistant is disposing of various items after completing patient procedures. Which of the following items should be disposed in a regulated medical waste, biohazard, container rather than regular trash? Option A. Use alcohol prep pads and empty medication vials without residual medication. Option B. Blood-soaked gauze from a wound dressing change and saturated surgical sponges. Option C. Paper towels used to wipe down the examination table after a well patient visit. Option D. Examination gloves that contacted intact skin during a routine vital signs assessment. The correct answer is B. Regulated medical waste includes items that release liquid or semi-liquid blood or other potentially infectious materials, OPM, when compressed, or items that would release these materials if handled. Blood-soaked gauze, saturated surgical sponges, and items caked with dried blood that could flake are classified as regulated medical waste and must be disposed in red biohazard containers. These items present a significant risk of transmitting blood-borne pathogens. Question 15. A patient with heart failure is being instructed on home monitoring. Which daily measurement is most important for detecting early signs of fluid retention? Option A. Blood pressure measurement. Option B. Daily weight measurement at the same time each day. Option C. Resting pulse oximetry reading. Option D. Fasting blood glucose level. The correct answer is B. Patients with heart failure are instructed to weigh themselves daily at the same time, typically morning, after voiding, before eating, wearing similar clothing. A weight gain of 2 to 3 pounds in 24 hours or 5 pounds in 1 week indicates fluid retention and may signal worsening heart failure before other symptoms appear. Early detection allows prompt intervention to prevent hospitalization. Question 16. A medical assistant is preparing a patient for a cardiac stress test. The patient is currently taking metoprolol, a beta blocker, for hypertension. Which instruction regarding medication should the assistant confirm with the provider before the test? Option A. Skip the metoprolol dose 24 to 48 hours before the test as directed by provider. Option B. Take the metoprolol as usual on the morning of the test. Option C. Switch to a different antihypertensive medication for the test day. Option D. Double the metoprolol dose the night before the test for better heart control. The correct answer is A. Beta blockers like metoprolol reduce heart rate and the heart's response to exercise, which can interfere with achieving the target heart rate needed for an effective stress test. Providers often instruct patients to hold beta blockers for 24 to 48 hours before the test. Provider-specific instructions vary, so the heart can respond normally to exercise stress. The medical assistant must verify this instruction with the provider and communicate it clearly to the patient. Question 17. A medical assistant is verifying informed consent for a minor surgical procedure. The patient signed the consent form, but appears confused when asked to explain the procedure. Which action should the assistant take first? Option A. Document the patient's confusion and proceed with the procedure. Option B. Tell the patient to read the consent form more carefully. Option C. Proceed with the procedure since the signed consent form is valid. Option D. Ask the provider to re-explain the procedure and confirm patient understanding. The correct answer is D. Informed consent requires both a signature and patient understanding of the procedure, risks, benefits, and alternatives. If a patient cannot explain what they are consenting to, informed consent is incomplete. The medical assistant should notify the provider to re-explain the procedure and verify understanding before proceeding. A signature alone does not constitute valid informed consent without comprehension. Question 18. A medical assistant reviewing a medication storage area discovers that the refrigerator temperature log shows the temperature exceeded the safe range, 2 to 8 degrees Celsius, for vaccine storage for 4 hours yesterday. The vaccine inventory includes influenza, MMR, and varicella vaccines. Which action represents the correct response to this medication storage deviation? Option A. Move the vaccines to a different refrigerator and adjust the temperature log to reflect normal storage conditions. Option B. Continue using the vaccine since the temperature deviation was brief, only 4 hours, and likely did not affect potency. Option C. Discard all vaccines in the refrigerator immediately without consulting anyone since any temperature deviation makes vaccines unsafe. Option D. Quarantine the affected vaccines, mark them do not use, document the temperature deviation, and immediately notify the provider and vaccine coordinator for guidance. The correct answer is D. Temperature excursions outside the recommended range, 2 to 8 degrees Celsius for most vaccines, may affect vaccine potency. The correct response is to immediately quarantine affected vaccines, mark do not use, document the deviation with specifics, temperature, duration, and notify the provider and vaccine coordinator who will consult State Immunization Program or CDC for guidance on whether vaccines remain usable or must be discarded. Question 19. Which CMS form is used by physicians and non-institutional providers to bill Medicare Part B and other payers for outpatient services? Option A, UB04. Option B, ADA 2019. Option C, CMS 1500. Option D, HCFA 1450. The correct answer is C. The CMS 1500, formerly HCFA 1500, is the standard claim form used by physicians, allied health professionals, and non-institutional providers to bill Medicare Part B, Medicaid, and other commercial insurers for outpatient professional services. Its electronic equivalent is the 837P transaction. Question 20. A medical assistant notices that a colleague has been documenting vital signs on paper instead of entering them directly into the electronic health record. The assistant also observed that the colleague skipped hand hygiene between patients during a busy flu clinic. Which action best reflects proper incident reporting and risk management procedures? Option A. Ignore both issues because the clinic was extremely busy and shortcuts were necessary. Option B. Report the colleague to the State Medical Board for professional misconduct investigation. Option C. Report the observed safety variances through the clinic's incident reporting system for review. Option D. Confront the colleague directly and demand they change their practices immediately. The correct answer is C. Risk management and quality assurance procedures require reporting of unsafe practices and patient safety variances through established internal reporting systems. This allows the organization to identify patterns, provide corrective education, and improve patient safety. Incident reports are confidential quality improvement tools, not punitive actions. Skipping hand hygiene and documentation shortcuts represent significant infection control and patient safety risks that require formal reporting. Question 21. A medical assistant is triaging walk-in patients at a busy urgent care clinic. 4 patients have just arrived simultaneously. Which patient should be prioritized for immediate intake? Option A 55-year-old with sudden onset chest pressure that began 20 minutes ago while walking. Option B, a 28-year-old with a minor laceration on the finger from a kitchen knife accident. Option C, a 5-year-old with a fever of 102 degrees Fahrenheit and complaints of ear pain. Option D, a 40-year-old requesting a refill for an anxiety medication prescription. The correct answer is A. Sudden onset chest pressure in an adult requires immediate prioritization due to the potential for acute cardiac event, myocardial infarction, angina, or other life-threatening conditions. Chest pain is a high-acuity presentation that cannot wait. The other patients have conditions of lower immediate urgency, minor laceration, pediatric fever, and prescription refill. Question 22. A medical assistant is reviewing ICD-10 CM coding guidelines. Which ICD-10 CM code is used to report essential, primary, hypertension in an adult patient when no specific hypertensive complication is documented? Option A, I11.9. Option B, I10. Option C, I15.9. Option D, I12.9. The correct answer is B. ICD-10 CM code I10 is the specific code for essential, primary, hypertension without documented complications. Essential hypertension is high blood pressure with no identifiable cause and no documented heart, kidney, or other organ involvement. This is one of the most commonly used ICD-10 CM codes in primary care settings for routine hypertension management. Question 23. A medical assistant is setting up a sterile field for a minor surgical procedure. Which action demonstrates correct sterile technique? Option A, place sterile supplies within 1 inch of the field edge for easy access. Option B, pour sterile solution from a height of 12 inches above the sterile field. Option C, touch the outer 1-inch border of the sterile drape with clean, non-sterile hands. Option D, reach across the sterile field to retrieve an item from the opposite side. The correct answer is C. The outer 1-inch border of a sterile drape is considered non-sterile and serves as a safety margin. Clean, non-sterile hands may touch this border when positioning the drape. All items placed on the sterile field must be sterile, and only sterile gloved hands should touch the inner sterile area. This technique maintains the integrity of the sterile field. Question 24. A public health department contacts the medical office requesting immunization records for all pediatric patients born in 2020 for a community vaccination coverage study. Which HIPAA provision applies to this public health request for protected health information? Option A, the office should refuse the request and direct the public health department to request records from each family individually. Option B, the medical assistant should release all records in the practice since public health studies require complete data sets. Option C, HIPAA prohibits all disclosures to public health departments without individual patient authorization for each child. Option D, HIPAA permits disclosure to public health authorities for public health purposes without individual authorization, subject to minimum necessary. The correct answer is D. HIPAA permits covered entities to disclose PHI to public health authorities without individual authorization for authorized public health purposes, including disease prevention, immunization programs, and public health surveillance. The disclosure must meet the minimum necessary standard. Only the information needed for the public health purpose should be released. The medical assistant should verify the requester's identity as a legitimate public health authority and apply minimum necessary principles. Question 25. Which of the following correctly describes the three CLA complexity levels for laboratory testing? Option A, waived tests have no quality control requirements. Moderate complexity tests require monthly QC. High complexity tests require daily QC only. Option B, waived tests can only be performed by physicians. Moderate complexity tests are performed by nurses. High complexity tests are performed by laboratory technologists. Option C, waived tests require minimal training and are low risk. Moderate complexity tests require more training and proficiency testing. High complexity tests require extensive training and specialized personnel. Option D, waived tests require no training. Moderate complexity tests require basic training. High complexity tests require advanced certification. The correct answer is C. CLA, Clinical Laboratory Improvement Amendments, establishes three complexity levels based on test difficulty and risk. Waived tests are simple, low-risk procedures requiring minimal training, e.g., urine dipstick, rapid strep. Moderate complexity tests require more training, proficiency testing, and quality control, e.g., hematology analyzers, some chemistry tests. High complexity tests require extensive training, specialized personnel, and rigorous QC, e.g., blood banking, complex microbiology. CMAs typically perform waived and some moderate complexity tests. Question 26. A medical assistant observes a 58-year-old patient walking into the examination room. The patient walks with short, shuffling steps, has difficulty initiating movement, and exhibits reduced arm swing on both sides. Which musculoskeletal finding best describes this gait pattern? Option A, hemiplegic gait indicating stroke with unilateral weakness. Option B, ataxic gait indicating cerebellar dysfunction. Option C, festinating gait associated with Parkinsonian symptoms. Option D, spastic gait indicating upper motor neuron lesion. The correct answer is C. A festinating gait is characterized by short, shuffling steps, difficulty initiating movement, start hesitation, reduced arm swing, and a tendency to accelerate while walking. This pattern is classic for Parkinson's disease or Parkinsonian syndrome, caused by dopamine deficiency affecting motor control. The patient should be reported to the provider for neurological evaluation. Question 27. A 68-year-old patient with chronic kidney disease asks the medical assistant about taking ibuprofen for occasional knee pain. Which response by the medical assistant is appropriate? Option A, ibuprofen is safe to take occasionally as long as you don't exceed the recommended dose. Option B, ibuprofen is fine if you take it with food to protect your stomach. Option C, NSAIDs like ibuprofen can worsen kidney function and may not be safe for you. Let me check with your provider before you take it. Option D, you should take acetaminophen instead because it works better for knee pain than ibuprofen. The correct answer is C. NSAIDs, including ibuprofen, are contraindicated or require caution in patients with chronic kidney disease because they can reduce renal blood flow and worsen kidney function. The medical assistant should recognize this contraindication, inform the patient of the concern, and refer to the provider for guidance rather than providing medical advice about medication selection. Question 28. A medical assistant is administering a tuberculin skin test, PPD/MAN2 test. At what time interval should the patient return for reading of the test result? Option A, 48 to 72 hours after placement. Option B, 5 to 7 days after placement. Option C, 24 hours after placement. Option D, 10 to 14 days after placement. The correct answer is A. The tuberculin skin test, PPD/MAN2 test, must be read 48 to 72 hours after placement. This time window allows sufficient time for the immune reaction to develop if the patient has been exposed to tuberculosis. Reading too early may miss a developing reaction. Reading too late may result in a fading reaction and false negative interpretation. Question 29. A 4-year-old pediatric patient needs pain assessment before an immunization. Which pain scale is most appropriate for this age group? Option A, Wong-Baker-Faces Pain Rating Scale. Option B, Numeric Rating Scale, 0 to 10. Option C, Visual Analog Scale, VS. Option D, Flack Behavioral Pain Scale. The correct answer is A. The Wong-Baker-Faces scale uses 6 facial expressions ranging from happy, 0, to crying, 10, and is designed for children ages 3 to 8 years. A 4-year-old can understand and point to the face that matches their pain level, making this the most appropriate scale for this age group. Question 30. A medical assistant is participating in an internal audit of the practice's billing records. The audit reveals that 3 claims were submitted with incorrect diagnosis codes that resulted in higher reimbursement than the correct codes would have generated. The errors were unintentional clerical mistakes. According to compliance program requirements, what is the appropriate response to these audit findings? Option A, inform the patients of the billing errors and ask them to pay the difference between billed and correct amounts. Option B, report the findings to the compliance officer, correct the coding errors, refund the overpayments, and document the corrective action. Option C, correct the errors quietly and continue billing. No reporting needed since mistakes were unintentional. Option D, wait for external auditors to discover the errors and then address them during the external audit process. The correct answer is B. Internal audits are a core element of compliance programs and should identify billing errors promptly. When errors are discovered, whether intentional or unintentional, the appropriate response includes 1. Reporting findings to the compliance officer, 2. Correcting the errors, 3. Refunding any overpayments within the 60-day Medicare requirement, and 4. Documenting corrective actions to demonstrate compliance program effectiveness. Even unintentional errors that result in overpayment must be corrected and refunded. Question 31. A medical assistant receives a denial for a claim submitted 45 days ago. The denial reason states CO 29. The time limit for filing the claim has expired. The insurance company's filing deadline is 90 days from the date of service. The medical assistant verifies that the claim was initially submitted 45 days ago. Which action should the medical assistant take? Option A, appeal the denial claiming the insurance company's clock is incorrect and the claim was submitted on time. Option B, change the date of service on the claim to a more recent date to avoid the filing deadline issue. Option C, contact the patient to request payment for the denied service since the insurance rejected the claim. Option D, review the original submission date and claim details to determine why the payer calculated a different submission timeline, then resubmit with proof of timely filing if applicable. The correct answer is D. When a claim is denied for timely filing, CO 29, the medical assistant should first investigate why the payer's calculation differs from the office's records. This may involve checking the original submission date, confirming electronic submission timestamps, reviewing any rejected submissions that required correction, and gathering proof of timely filing, electronic confirmations, date stamps. If the claim was genuinely filed within the deadline, an appeal with documentation proving timely submission should be submitted. Question 32. A medical assistant is preparing a patient for a minor surgical procedure. Which intervention is most critical for preventing surgical site infections, SSI? Option A. Applying sterile drapes that cover only the immediate incision area. Option B. Cleaning the surgical site with normal saline immediately before the procedure. Option C. Administering prophylactic antibiotics within 60 minutes before incision as ordered. Option D. Shaving the surgical site with a razor the night before surgery. The correct answer is C. Prophylactic antibiotics administered within 60 minutes before surgical incision, 120 minutes for vancomycin and fluoroquinolones, significantly reduce surgical site infection rates by ensuring adequate tissue concentrations at the time of potential bacterial contamination. This timing is critical. Too early and levels drop before incision, too late and bacteria already established. The medical assistant's role includes ensuring timely administration per provider order. Question 33. A 4-year-old child with asthma is prescribed a nebulizer treatment with albuterol at home. The parent asks how to use the nebulizer. Which instruction should the medical assistant provide? Option A. Turn on the machine only after the medication cup is empty to prevent spills. Option B. Have the child hold the mouthpiece in their mouth and breathe as fast and deep as possible for 5 minutes. Option C. Add the medication to the cup, turn on the compressor, place the mask snugly over the child's nose and mouth, and have them breathe normally until the mist stops. Option D. Place the mask loosely over the child's face and let them breathe normally until the mist stops, about 10 to 15 minutes. The correct answer is C. Proper nebulizer technique involves adding the prescribed medication to the nebulizer cup, connecting the tubing, turning on the compressor, positioning the mask snugly over the nose and mouth to ensure medication delivery, and allowing the child to breathe normally until the mist stops, typically 10 to 15 minutes. A snug mask fit ensures the medication reaches the airways rather than escaping into the room. Question 34. A patient with type 2 diabetes consistently arrives for appointments with blood glucose logs showing values above 250 milligrams per deciliter. When the medical assistant asks about medication adherence, the patient says, "I take it sometimes, but I forget a lot." Which motivational interviewing technique should be used first? Option A. Warn the patient about the consequences of uncontrolled diabetes. Option B. Ask an open-ended question exploring the patient's experience with medication routines. Option C. Schedule a consultation with a diabetes educator immediately. Option D. Provide a pill organizer and set up phone reminders. The correct answer is B. The first step in motivational interviewing is using open-ended questions to explore the patient's perspective, barriers, and experiences. Understanding why the patient forgets medications, schedule, side effects, beliefs, allows for targeted, patient-centered solutions rather than imposing external strategies that may not fit the patient's lifestyle. Question 35. A medical assistant works at a clinic that contracts with an external billing company to process insurance claims. The billing company receives patient names, diagnoses, and treatment codes to submit claims. Which legal document must exist between the clinic and the billing company to comply with HIPAA? Option A. Informed consent form signed by each patient. Option B, Business Associate Agreement, BAA, establishing safeguards and obligations for PHI handling. Option C, Standard Commercial Service Contract without PHI-specific provisions. Option D, Joint Employment Contract making the billing company employees of the clinic. The correct answer is B. A Business Associate Agreement, BAA, is a legally required contract between a covered entity, the clinic, and a business associate, the billing company, that handles PHI on its behalf. The BAA establishes the business associate's obligations to implement safeguards, use PHI only for specified purposes, report breaches, and ensure subcontractor compliance. Question 36. A patient with hypertension is prescribed lisinopril, an angiotensin-converting enzyme, ACE, inhibitor. The medical assistant should recognize that this medication belongs to which drug classification? Option A, antibiotic. Option B, antihypertensive. Option C, antidiabetic. Option D, analgesic. The correct answer is B. Lisinopril is an ACE inhibitor used to lower blood pressure by blocking the conversion of angiotensin I to angiotensin II, a potent vasoconstrictor. ACE inhibitors are classified as antihypertensive medications and are first-line treatments for hypertension. Question 37. A medical assistant is reviewing a safety data sheet, SDS, for a cleaning chemical used to disinfect examination tables. The SDS shows a pictogram of a flame with a line underneath it. What hazard does this GHS pictogram represent? Option A, corrosive, causes severe skin burns and eye damage. Option B, flammable, can catch fire easily under normal conditions. Option C, environmental hazard, toxic to aquatic life. Option D, health hazard, may cause serious long-term health effects. The correct answer is B. The GHS pictogram showing a flame with a horizontal line underneath it represents flammable materials. This hazard category includes substances that can ignite easily under normal handling conditions. Staff must store these chemicals away from heat sources and ignition points and ensure proper ventilation when using them. Question 38. Which Korotkoff sound phase represents the systolic blood pressure reading? Option A, phase 5, sounds disappear completely. Option B, phase 2, sounds become softer and swishing. Option C, phase 1, first appearance of clear tapping sounds. Option D, phase 4, sounds become muffled. The correct answer is C. Korotkoff phase 1 is the first clear tapping sound heard as the cuff pressure falls below the systolic pressure, allowing blood to pulse through the artery. This marks the systolic blood pressure reading. Phase 5, disappearance of sounds, marks the diastolic pressure in adults. Question 39. A medical assistant is reviewing a complex billing case. The patient received 3 services during one visit: an office visit, CPT 99213, a blood draw, CPT 36415, and a laboratory test, CPT 80053. The submitted claim was denied with the following ERA codes: CARC4, procedure code inconsistent with modifier, CARC 97, benefit for this service is included in another service, and RARC N350. Procedure requires modifier to identify separately identifiable service. The medical assistant determines that modifier -25 should have been appended to CPT 99213. Which action correctly addresses this denial? Option A, resubmit the claim appending modifier -25 to CPT 99213 to indicate the office visit was separately identifiable from the blood draw and lab services. Option B, Submit an appeal stating that the insurance company incorrectly denied the claim without reviewing the medical record. Option C. Bill the patient directly for all 3 services since the insurance denied the combined claim. Option D. Remove the blood draw and laboratory codes from the claim and resubmit only the office visit code. The correct answer is A. Modifier -25 indicates a significant, separately identifiable evaluation and management (E/M) service performed on the same day as another procedure or service. When an office visit occurs on the same day as a blood draw and laboratory testing, modifier -25 must be appended to the E/M code 99213 to clarify that the office visit was distinct and medically necessary beyond the procedures performed. The ERA codes indicate the payer recognized this modifier requirement and denied the claim for its absence. Question 40. During a sterile procedure, a medical assistant accidentally touches the edge of the sterile field with a non-sterile sleeve. What is the correct action? Option A. Immediately redrape the entire sterile field with new sterile towels. Option B. Apply an alcohol wipe to the touched area and proceed with the procedure. Option C. Consider the entire field contaminated and set up a new sterile field before continuing. Option D. Continue the procedure since the edge is considered the margin of safety. The correct answer is C. The sterile field boundaries must be maintained to prevent contamination. The 1-inch border, margin, around the edge of a sterile draped table is considered the boundary. The area within this margin is sterile, but items touching the edge or falling below table level are considered contaminated. If a non-sterile item touches any part of the sterile field, including within the margins, the entire field must be considered contaminated and a new sterile field established. Sterile technique requires zero tolerance for contamination during invasive procedures. Question 41. A medical assistant is assisting with documentation for a patient enrolled in a chronic care management (CCM) program for diabetes. Which documentation elements are specifically required for CCM billing compliance? Option A. Standard visit documentation is sufficient. No additional elements are needed for chronic care management. Option B. Documentation must include time spent on care coordination activities, patient communication, and monthly care management services provided. Option C. Chronic care management requires only a single diagnosis code with no activity documentation. Option D. The medical assistant should document only vital signs. Care coordination activities do not need documentation. The correct answer is B. Chronic care management (CCM) services require specific documentation for billing compliance. This includes documenting the time spent on care coordination activities, minimum 20 minutes per month for CCM, patient communication regarding their chronic conditions, and the specific care management services provided monthly. Without this documentation, CCM billing claims may be denied. Question 42. A medical assistant is preparing for a telehealth visit with a patient located in a different state. The patient's state has different regulations for medical assistant scope of practice than the MA's home state. Which legal consideration is most important for telehealth services? Option A. Telehealth visits are exempt from state licensure and scope of practice regulations. Option B. The medical assistant should follow the scope of practice laws of the clinic's location. Option C. The medical assistant should follow the scope of practice laws of the patient's location. Option D. Medical assistants cannot participate in telehealth visits with out-of-state patients. The correct answer is C. Telehealth services generally must comply with the regulations of the state where the patient is located at the time of the visit. This includes scope of practice requirements, licensure considerations, and informed consent laws. Healthcare providers delivering services remotely must be aware of the patient's state regulations. Question 43. Which of the following correctly describes the relationship between C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR? Option A, both CRP and ESR rise and fall at identical rates, making them interchangeable tests. Option B, CRP changes slowly over weeks. ESR rises immediately within hours of inflammation onset. Option C, CRP is specific to cardiac inflammation only. ESR measures general inflammation. Option D, CRP rises and falls quickly with inflammation. ESR changes slowly and remains elevated longer after inflammation resolves. The correct answer is D. CRP and ESR are both nonspecific markers of inflammation. CRP rises rapidly, within 6 to 10 hours, after inflammatory stimulus and falls quickly, within 48 hours, when inflammation resolves, making it useful for monitoring acute changes. ESR rises more slowly over days and remains elevated for weeks after inflammation resolves, making it better for monitoring chronic conditions. CRP is more sensitive and responsive to acute changes. Question 44. A 78-year-old patient with advanced chronic kidney disease presents with a PLSD form indicating "do not intubate" and "comfort measures only." The patient's daughter requests that everything possible be done if her father has a medical emergency. Which response reflects proper understanding of PLSD? Option A. The PLSD constitutes a valid medical order that must be followed by all healthcare providers. Option B. A new PLSD must be completed immediately to reflect the daughter's preferences. Option C. The PLSD can be ignored in an emergency situation until the physician arrives. Option D. The daughter's wishes override the PLSD since she is the family member present. The correct answer is A. PLSD physician orders for life-sustaining treatment. Forms are medical orders signed by a physician that must be honored by all healthcare providers across care settings. Unlike advance directives which document patient wishes, PLSD converts those wishes into actionable medical orders that are legally binding. Question 45. A patient with diabetes presents for laboratory testing. The provider orders a hemoglobin A1C test. Which of the following correctly describes the purpose and interpretation of the hemoglobin A1C test? Option A. It measures insulin production by the pancreas and predicts future diabetes risk. Option B. It measures current blood glucose at the time of collection and reflects immediate dietary intake. Option C. It measures ketone levels and detects diabetic ketoacidosis. Option D. It measures average blood glucose control over the past 2 to 3 months and reflects long-term diabetes management. The correct answer is D. Hemoglobin A1C, HbA1c, is a glycated hemoglobin test that reflects average blood glucose levels over the preceding 2 to 3 months. This timeframe corresponds to the lifespan of red blood cells, 120 days. The test does not require fasting. A1C values of 6.5% or higher indicate diabetes, while values below 5.7% are normal. Values between 5.7 to 6.4% indicate prediabetes. It is a critical marker for assessing long-term diabetes control. Question 46. A 55-year-old patient with obesity, sleep apnea, and gastroesophageal reflux disease, GERD, is preparing for outpatient surgery under general anesthesia. Which combination of preoperative assessments and precautions is most critical for this patient's anesthesia safety? Option A. Complete metabolic panel, liver function tests, and nutrition consultation. Option B, pulmonary function tests, chest X-ray, and pulmonary specialist consultation. Option C, airway assessment, NPO status verification, and discussion of postoperative CPAP use. Option D, baseline EKG, cardiac stress test, and cardiology clearance. The correct answer is C. Patients with obesity and sleep apnea present specific anesthesia challenges, difficult airway management, increased aspiration risk from GERD, and postoperative respiratory depression requiring CPAP. The most critical preoperative focus includes thorough airway assessment, Mallampati score, neck circumference, strict NPO verification to minimize aspiration risk, and coordination of postoperative CPAP for airway support during recovery. Question 47. A patient's insurance plan has a $500 deductible, 80/20ths coinsurance, and a $2,000 out-of-pocket maximum. The patient has previously paid $300 toward the deductible this year. A procedure is performed with an allowed amount of $1,000. What is the patient's total responsibility for this claim? Option A, $500. Option B, $200. Option C, $360. Option D, $340. The correct answer is C. The patient has $200 remaining on their deductible, $500 minus $300 already met. That $200 is applied first. After the deductible is met, the remaining $800, $1,000 minus $200, is subject to 80/20ths coinsurance, making the patient responsible for 20% of $800 equals $160. Total patient responsibility, $200 plus $160 equals $360. The out-of-pocket maximum is not reached. $300 prior plus $360 equals $660. Question 48. A medical assistant is preparing a patient for a 12-lead EKG. Where should the green electrode be placed? Option A, right arm. Option B, right leg. Option C, left leg. Option D, left arm. The correct answer is C. The standard color coding for limb electrodes is white, right arm, black, left arm, red, right leg, and green, left leg. The mnemonic white on right, smoke, black over fire, red, green on left is commonly used. Question 49. Which component of the medical history uses the old CARTS mnemonic? Option A, social history. Option B, history of present illness. Option C, review of systems. Option D, family history. The correct answer is B. Old CARTS, onset, location, duration, character, aggravating factors, relieving factors, timing, severity, is the standard mnemonic for structuring the history of present illness, HPI. It ensures the medical assistant gathers complete details about the patient's chief complaint. Question 50. A 52-year-old patient is recovering from a myocardial infarction, heart attack, and is being discharged with cardiac rehabilitation instructions. Which education point should the medical assistant include? Option A, avoid all physical activity for at least 6 weeks to let your heart heal completely. Option B, gradually increase activity as directed by your provider, participate in supervised exercise sessions if prescribed, and report any chest pain, shortness of breath, or dizziness immediately. Option C, exercise is only safe if you never feel tired or have any symptoms during activity. Option D, return to your normal exercise routine immediately to prevent muscle loss during recovery. The correct answer is B. Post-MI cardiac rehabilitation involves progressive, supervised activity guided by the provider. Patients should follow prescribed exercise protocols, often beginning with cardiac rehabilitation programs that monitor heart rate and symptoms. Warning signs, chest pain, dyspnea, dizziness, require immediate stopping and reporting. The goal is safe, gradual return to function while protecting the recovering heart. Question 51. A patient presents with a sore throat and fever. The medical assistant performs both a rapid strep test and collects a throat culture. The rapid strep test is negative. What should the medical assistant understand about these results? Option A. The throat culture is unnecessary since the rapid test was negative. Option B. The negative rapid test rules out strep throat. No further action is needed. Option C. The rapid test is more accurate than the culture and should be trusted. Option D. The throat culture serves as a backup because rapid tests can produce false negatives. The correct answer is D. Rapid strep tests have high specificity but lower sensitivity, meaning false negatives can occur. A negative rapid test in a patient with classic strep symptoms should be followed up with a throat culture, which is the gold standard. The culture takes 24 to 48 hours, but will detect strep bacteria that the rapid test may have missed. Question 52. A patient calls to cancel an appointment scheduled for tomorrow morning due to a work conflict. The medical assistant notices the patient has canceled 3 appointments in the past 2 months without rescheduling. Which action should the medical assistant take? Option A. Cancel the appointment, offer to reschedule, and document the cancellation pattern according to office policy. Option B. Refuse to cancel the appointment and require the patient to keep the scheduled time. Option C. Delete the appointment without further action since the patient initiated the cancellation. Option D. Transfer the call to the provider to handle patient cancellations personally. The correct answer is A. The medical assistant should process the cancellation request, offer alternative appointment times to maintain patient care continuity, and document the cancellation according to office no-show/cancellation tracking protocols. Multiple cancellations without rescheduling may indicate barriers to care that should be addressed, and documentation supports office policies for repeated cancellations. Question 53. A medical assistant is preparing to fax laboratory results to a specialist's office. The patient's insurance information and social security number appear on the original document. Which action should the medical assistant take before faxing to comply with HIPAA requirements? Option A. Include a cover sheet stating that the patient has authorized release of all information. Option B. Fax the complete document as is since specialist offices are healthcare providers authorized to receive PHI. Option C. Fax only the laboratory values without any patient identifying information. Option D. Remove or obscure the insurance and social security number information before faxing, applying the minimum necessary standard. The correct answer is D. When faxing PHI, the minimum necessary standard requires that only information needed for the intended purpose be transmitted. Social security numbers and insurance details are typically not needed by a specialist for interpreting laboratory results. The medical assistant should remove, redact, or obscure unnecessary identifying information before faxing to protect patient privacy while still providing relevant clinical information. Question 54. What is the key distinction between medical malpractice and general negligence in healthcare settings? Option A. Malpractice requires that the breach of duty occurred within a professional healthcare relationship with specialized standards of care. Option B. Negligence only applies to administrative errors while malpractice applies to clinical errors. Option C. Malpractice involves criminal intent while negligence involves accidental harm. Option D. Malpractice can only be committed by physicians while negligence can be committed by any staff member. The correct answer is A. Medical malpractice is a specific type of negligence that occurs within a professional healthcare relationship. The key distinction is that malpractice involves breach of a professional duty with specialized standards of care that apply specifically to healthcare providers. General negligence involves failure to exercise ordinary reasonable care in non-professional contexts. Both require duty, breach, causation, and damages, but malpractice applies professional standards rather than ordinary care standards. Question 55. A medical assistant is providing discharge instructions to a patient who is fitted with a walker due to knee surgery. Which instruction is correct regarding proper walker use? Option A. Pull the walker forward first, then step into it with both feet simultaneously. Option B. Step forward with the weak leg first while pushing the walker, then bring the strong leg forward. Option C. Push the walker ahead, step forward with the strong leg first, then bring the weak leg forward. Option D. Lift the walker completely off the ground and carry it while walking to prevent it from sliding. The correct answer is B. Proper walker technique follows the rule: move the walker first, then step with the weak leg, then bring the strong leg forward. This sequence ensures the walker provides support when the patient places weight on the weaker or recovering limb. The patient should push or lift the walker forward, step into it with the affected leg, and then advance the unaffected leg. Question 56. Which HIPAA security rule safeguard category includes policies and procedures for managing EPHI security, workforce training, and security risk assessments? Option A. Technical safeguards. Option B. Operational safeguards. Option C. Physical safeguards. Option D. Administrative safeguards. The correct answer is D. Administrative safeguards are organizational policies and procedures designed to manage the selection, development, implementation, and maintenance of security measures for EPHI. They include security management processes, workforce security training, information access management, and security awareness programs. Question 57. A medical assistant is collecting a urine specimen for drug testing as part of a pre-employment screening. The employer has requested an observed collection. What is the primary reason for performing an observed collection? Option A. To ensure the patient washes their hands before providing the specimen. Option B. To verify the patient's identity before the collection begins. Option C. To prevent specimen tampering, substitution, or adulteration in high-risk situations. Option D. To ensure the patient provides an adequate volume of urine for testing. The correct answer is C. Observed collection involves a same-gender observer directly watching the urine leave the donor's body and enter the collection container. This is required in specific situations: return-to-duty testing, follow-up testing after a positive result, when tampering is suspected, or when required by employer policy for safety-sensitive positions. The observation prevents the donor from substituting someone else's urine, adding adulterants, or diluting the specimen. Standard collections are unobserved with privacy maintained. Question 58. A 45-year-old patient asks if Medicaid will cover her upcoming visit. Which factor is most important in determining Medicaid eligibility? Option A. The patient's employment status with a large corporation. Option B. The patient's income level and categorical eligibility, such as pregnancy, disability, or age. Option C. Whether the patient has exhausted all private insurance options. Option D. the patient's prior history of Medicaid enrollment. The correct answer is B. Medicaid eligibility is determined primarily by income level and categorical eligibility criteria set by federal and state guidelines. Categories include pregnant women, children, elderly individuals, persons with disabilities, and in some states, adults under certain income thresholds. Each state has its own income limits and may have additional eligibility pathways through Medicaid expansion under the Affordable Care Act. Question 59. A medical assistant is caring for a patient in the post-anesthesia care unit, PACU. The patient's oxygen saturation drops from 98% to 89%, and they exhibit noisy, irregular respirations. What is the priority action? Option A. Immediately notify the anesthesia provider and prepare for airway intervention. Option B. Document the findings and wait for the anesthesia provider. Option C. Stimulate the patient and encourage deep breathing. Option D. Increase the fluid rate to improve oxygen delivery. The correct answer is A. A sudden drop in SpO2 to 89% with irregular respirations in a postoperative patient indicates potential airway obstruction, respiratory depression, or residual anesthesia effects. This is a critical situation requiring immediate notification of the anesthesia provider and preparation for possible airway intervention, including positioning, oxygen supplementation, or bag valve mask ventilation. Question 60. A medical assistant is preparing the skin for a minor surgical procedure. Which antiseptic solution should be applied using a concentric circular motion starting from the incision site outward? Option A. Chlorhexidine gluconate. Option B. Isopropyl alcohol 70%. Option C. Hydrogen peroxide 3%. Option D. Povidone iodine betadine. The correct answer is D. Povidone iodine betadine is the standard antiseptic for surgical skin preparation and is applied using a concentric circular motion from the incision site outward to prevent contamination from the unprepared peripheral skin being brought back toward the sterile central area. This technique ensures the cleanest area is the surgical site itself. Question 61. A medical assistant calculates a patient's BMI using the formula weight kg divided by height m superscript 2. The patient weighs 176 pounds and is 5 feet 8 inches tall. After conversion, 80 kilograms, 1.73 m, the calculated BMI is 26.8. How should the medical assistant interpret and document this finding? Option A. Document BMI 26.8 underweight and flag for nutritional assessment. Option B. Document BMI 26.8 overweight and note this finding for provider review. Option C. Document BMI 26.8 obesity class 1 and recommend weight loss counseling. Option D. Document BMI 26.8 normal weight and proceed with the visit. The correct answer is B. BMI categories are underweight. Question 62. A medical assistant provides written discharge instructions to a patient with newly diagnosed diabetes. The instructions include monitor fasting blood glucose daily, maintain HbA1c below 7%, follow a low glycemic diet, and increase physical activity to 150 minutes weekly. The patient looks overwhelmed and says nothing. When asked to explain the plan, the patient cannot describe any of the instructions correctly. Which combination of communication failures is most evident? Option A. Therapeutic silence used incorrectly and missing referral to specialist. Option B. Lack of visual aids and inappropriate use of closed-ended questions. Option C. Insufficient written detail and failure to schedule a follow-up appointment. Option D, use of medical jargon without plain language adaptation and failure to use teachback during instruction. The correct answer is D. The instructions contain medical terminology, fasting blood glucose, HbA1c, low glycemic, that patients with limited health literacy may not understand. Additionally, teachback was only used after the patient appeared overwhelmed, rather than being integrated throughout the education session. Both failures combined to prevent comprehension. Question 63. A medical assistant's hands are visibly soiled with blood after assisting with a wound care procedure. Which hand hygiene method is appropriate? Option A, wipe hands with a disinfectant wipe and immediately proceed to the next patient. Option B, put on clean gloves without performing hand hygiene since gloves provide protection. Option C, wash hands with soap and water for at least 20 seconds, then apply hand lotion. Option D, apply alcohol-based hand rub for 15 seconds and continue with patient care. The correct answer is C. When hands are visibly soiled with blood or other body fluids, alcohol-based hand rubs are not sufficient because they do not remove physical contaminants. Hand washing with soap and water is required to mechanically remove the soil and pathogens. The CDC and WHO recommend washing with soap and water for at least 20 seconds when hands are visibly dirty. After thorough drying, hand lotion may be applied to maintain skin integrity and prevent drying from frequent washing. Question 64. A medical assistant needs to collect blood from an elderly patient with fragile, small veins. Which venipuncture equipment should the assistant select for this patient? Option A, 21-gauge needle with evacuated tube system. Option B, 18-gauge needle with evacuated tube system. Option C, 23-gauge butterfly needle with syringe. Option D, 25-gauge needle with evacuated tube system. The correct answer is C. For patients with fragile, small veins such as elderly patients, a butterfly needle, winged infusion set, with a smaller gauge, 23G, and syringe collection is preferred. The butterfly allows better control and visualization, the smaller gauge reduces vein trauma, and the syringe permits gentle aspiration to prevent vein collapse from vacuum pressure. Question 65. Under HIPAA breach notification requirements, covered entities must notify affected patients within what maximum time frame after discovering a breach of unsecured protected health information? Option A, 30 calendar days. Option B, 120 calendar days. Option C, 60 calendar days. Option D, 90 calendar days. The correct answer is C. HIPAA requires covered entities to provide written notification to individuals affected by a breach of unsecured PHI without unreasonable delay and in no case later than 60 calendar days from discovery of the breach. This timeline ensures patients are informed promptly to take protective actions against potential harm from the exposure. Question 66. What is the primary difference between NSAIDs, nonsteroidal anti-inflammatory drugs, and acetaminophen in terms of their mechanism of action? Option A, both NSAIDs and acetaminophen have equal anti-inflammatory effects. Option B, NSAIDs are only for pain, acetaminophen is only for fever. Option C, acetaminophen reduces inflammation, NSAIDs do not have anti-inflammatory properties. Option D, NSAIDs reduce inflammation, acetaminophen does not have anti-inflammatory properties. The correct answer is D. NSAIDs, ibuprofen, naproxen, aspirin, Inhibit cyclooxygenase, COX, enzymes, reducing prostaglandin production, which decreases inflammation, pain, and fever. Acetaminophen reduces pain and fever through central nervous system mechanisms, but does not inhibit peripheral COX enzymes significantly, so it lacks meaningful anti-inflammatory effects. Question 67. A medical assistant is measuring vital signs on a 2-month-old infant in the pediatric clinic. Which technique is correct for obtaining blood pressure in this age group? Option A. Use a pediatric cuff and measure blood pressure in the standing position. Option B. Use the thigh with a large adult cuff because infant arms are too small. Option C. Select an infant-sized cuff, measure in the supine position, and use the right arm. Option D. Use a standard adult cuff and measure in the seated position. The correct answer is C. Infant blood pressure measurement requires an appropriately sized infant cuff, smaller bladder width, supine positioning, and typically the right arm, preferred due to proximity to the aortic arch. Infants cannot sit or stand cooperatively, and proper cuff sizing is critical for accuracy. Using inappropriate cuff sizes or positions yields unreliable readings. Question 68. A medical assistant is providing education to a patient newly prescribed an antidepressant medication. Which information should be included as part of standard medication education? Option A. The medication's name, purpose, common side effects, and when to contact the provider for concerning symptoms. Option B. Only the medication's name and dosing schedule to keep instructions simple. Option C. Instructions to stop taking the medication immediately if any side effect occurs. Option D. A detailed explanation of how the medication affects neurotransmitters in the brain. The correct answer is A. Comprehensive patient education on a new medication should include the drug's name, both generic and brand if applicable, its purpose or indication, common side effects to expect, and guidance on when to seek medical attention for serious or concerning symptoms. This education empowers patients to take medications safely, recognize expected effects, and identify warning signs requiring provider contact. Question 69. A hematology analyzer in the clinic laboratory fails daily quality control for 3 consecutive days. Results are consistently lower than expected values for the control sample. The medical assistant checks the analyzer and finds no obvious mechanical problems. Which comprehensive corrective action sequence is most appropriate? Option A. Discard all patient results from the past 3 days, recalibrate the analyzer, and repeat all patient testing. Option B. Continue patient testing, document the QC failures, and wait for scheduled maintenance. Option C. Stop patient testing, notify supervisor, check control solution expiration, rerun QC with fresh control, recalibrate analyzer if needed, document all actions. Option D. Skip QC testing for 1 day, perform patient testing, and resume QC the following day. The correct answer is C. A systematic approach to QC failures involves 1. Stopping patient testing immediately when QC fails, 2. Notifying supervisor, 3. Investigating possible causes, expired control solution, technique error, analyzer malfunction, 4. Rerunning QC with fresh control solution, 5. Performing recalibration or maintenance if repeat QC fails, 6. Documenting all corrective actions and outcomes, 7. Resuming patient testing only after QC passes. 3 consecutive QC failures indicate a persistent problem requiring systematic troubleshooting. Question 70. When obtaining informed consent for a procedure, which of the following accurately describes the medical assistant's appropriate role? Option A. Modify the consent form to include additional risks the MA believes are important. Option B. Determine whether the patient has capacity to consent and make clinical decisions. Option C. Witness the patient's signature and explain procedural steps within scope, but not obtain consent. Option D. Obtain the patient's signature and independently explain all risks and benefits. The correct answer is C. The medical assistant's role in informed consent is to witness the patient's signature and may explain procedural steps or logistics within scope, but the MA does not obtain consent. Obtaining informed consent, including explaining risks, benefits, alternatives, and ensuring the patient understands, is the responsibility of the provider performing the procedure. Question 71. Under most state laws, what is the typical minimum retention period for medical records of adult patients in a physician office setting? Option A. 7 years from the last visit or from the date of the patient's last encounter. Option B. 3 years from the last visit. Option C. 10 years after the patient reaches age 18. Option D. 5 years from the last visit or treatment. The correct answer is A. Medical record retention requirements vary by state, but the most common minimum retention period for adult patient records is 7 years from the last encounter or treatment. Some states require longer retention, and records for minors typically must be retained until the patient reaches adulthood, plus the standard retention period. Question 72. Which statement correctly distinguishes a personal health record, PHR, from an electronic health record, EHR? Option A. A PHR is patient-controlled and maintained, while an EHR is provider-controlled and maintained by healthcare facilities. Option B. An EHR is used only for billing purposes, while a PHR is exclusively for clinical documentation. Option C. Both EHR and PHR are identical systems that serve the same purpose in healthcare documentation. Option D. An EHR is patient-controlled, while a PHR is provider-controlled and maintained by healthcare facilities. The correct answer is A. An electronic health record, EHR, is a digital version of a patient's chart maintained by healthcare providers and facilities, containing the official medical record of care delivered. A personal health record, PHR, is a tool that allows patients to manage and maintain their own health information in a secure, private environment, separate from the provider's official medical record system. Question 73. A medical assistant discovers a blood spill on the floor of the examination room after a patient procedure. The spill is approximately 6 inches in diameter. Which is the correct sequence for managing this biohazard spill? Option A. Wipe with paper towels, apply disinfectant, dispose of towels in regular trash. Option B. Pour bleach directly on the spill, immediately wipe up, dispose in sharps container. Option C. Apply spill kit, absorbent material, wait 10-minute, scoop and dispose in biohazard container, disinfect area. Option D. Cover with a cloth, spray with alcohol, wait 5 minutes, dispose in regular trash. The correct answer is C. Biohazard blood spills require a specific cleanup protocol using a spill kit. The correct sequence involves applying absorbent material, such as specialized granules, to contain the spill, allowing appropriate contact time, typically 10 minutes, for the material to absorb and begin decontamination. Scooping the absorbed material into a biohazard container and then disinfecting the surface area with an appropriate disinfectant. This protocol minimizes aerosolization and ensures proper disposal. Question 74. When reading a nutrition label, which component should a patient with hypertension pay particular attention to in order to help manage their blood pressure? Option A. Protein content per serving. Option B, sodium content per serving. Option C, total sugar content per serving. Option D, total calories per serving. The correct answer is B. For patients with hypertension, sodium intake directly affects blood pressure control. The American Heart Association recommends limiting sodium to less than 2,300 milligrams daily, ideally 1,500 milligrams for those with hypertension. Teaching patients to read sodium content on nutrition labels empowers them to make informed dietary choices that support blood pressure management. Question 75. A medical assistant is preparing a patient for a fasting lipid panel. The patient states they ate a light breakfast at 7 a.m. The current time is 9 a.m. Which of the following is the most appropriate action? Option A, proceed with the venipuncture as 2 hours is sufficient fasting time. Option B, draw the blood but note on the requisition that the patient was not fasting. Option C, reschedule the blood draw for 9 to 12 hours after the patient's last meal. Option D, perform a finger stick glucose test instead, as this does not require fasting. The correct answer is C. A fasting lipid panel requires 9 to 12 hours of fasting for accurate results. Recent food intake can significantly affect triglyceride levels and other lipid values. Drawing blood only 2 hours after eating would produce inaccurate results that could lead to incorrect diagnosis or treatment decisions. Question 76. When performing a 12-lead EKG, which anatomical landmarks are used to determine the correct placement of precordial lead V1? Option A, 5th intercostal space, right midclavicular line. Option B, 4th intercostal space, right sternal border. Option C, 4th intercostal space, left sternal border. Option D, 5th intercostal space, left midclavicular line. The correct answer is B. Precordial lead V1 is placed in the 4th intercostal space at the right sternal border. This position records electrical activity from the right ventricle and is critical for detecting right ventricular abnormalities and rhythm interpretation. The intercostal spaces are numbered from the first space below the first rib. Question 77. A 4-year-old pediatric patient weighing 18 kilograms requires an intramuscular vaccine injection. The medical assistant must select the appropriate injection site and needle size. Which combination is most appropriate for this pediatric patient? Option A, ventrogluteal site with a 23-gauge, 1.5-inch needle. Option B, dorsogluteal site with a 22-gauge, 1.5-inch needle. Option C, vastus lateralis with a 25-gauge, 1-inch needle. Option D, deltoid muscle with a 25-gauge, 1-inch needle. The correct answer is C. For infants and young children, especially under 3 years, but up to school age for certain vaccines, the vastus lateralis is the preferred intramuscular injection site due to its large muscle mass and distance from major nerves and blood vessels. A 25-gauge, 1-inch needle is appropriate for IM injections in pediatric patients, providing adequate depth while minimizing discomfort. The deltoid may be used for older children with adequate muscle development. Question 78. A medical assistant is assisting with allergy skin testing when the patient suddenly develops diffuse itching, widespread hives, and begins wheezing. The provider is in the room. Which of the following actions should the medical assistant take first? Option A, administer epinephrine intramuscularly from the emergency kit. Option B, retrieve the emergency equipment and epinephrine for the provider. Option C, document the reaction time and symptoms in the allergy testing record. Option D, call 911 while the provider begins emergency treatment. The correct answer is B. During an anaphylactic reaction in a provider-supervised setting, the CMA's first role is to rapidly prepare emergency equipment and medications for the provider to administer. The provider is present and will administer epinephrine. The CMA supports by retrieving supplies, preparing the medication, and assisting with emergency response while the provider focuses on patient assessment and treatment. Question 79. A medical assistant is reviewing documentation requirements for incident to billing. Under Medicare guidelines, which requirement must be met for a medical assistant services to be billed incident to a physician service? Option A. The service must be provided in a hospital setting with physician oversight. Option B. The physician must have personally trained the medical assistant for each procedure. Option C. The physician must be physically present in the office suite during the entire service. Option D. The medical assistant must have at least 5 years of clinical experience. The correct answer is C. Medicare Incident to billing allows services provided by auxiliary personnel, such as medical assistants, to be billed under the physician's name when certain conditions are met. One critical requirement is that the physician must be physically present in the office suite and immediately available to provide assistance during the entire time the auxiliary personnel is performing the service. This ensures physician supervision and oversight. Question 80. A medical assistant is teaching a patient with asthma how to properly use a metered-dose inhaler, MDI. Which step should the assistant include in the demonstration? Option A. Exhale fully, place the mouthpiece between lips, press the canister while beginning a slow deep inhalation, and hold breath for 10 seconds. Option B. Hold the inhaler upright and shake it only after the medication has been released. Option C. Inhale quickly and deeply immediately after releasing the medication spray. Option D. Take several rapid breaths in succession after releasing the medication to ensure full absorption. The correct answer is A. Proper MDI technique requires coordinating medication release with slow, deep inhalation. The correct sequence is: exhale fully, seal lips around the mouthpiece, press the canister to release medication while beginning a slow, deep inhalation, then hold breath for 10 seconds to allow medication deposition in the airways. This technique maximizes drug delivery to the lungs. Question 81. A medical assistant is asked by the supervising physician to perform a task that is outside the CMA scope of practice, according to state regulations. The MA knows this task should only be performed by a licensed nurse. Which consequence could result if the MA performs this prohibited task? Option A. The MA could face disciplinary action from the AAMA, including certification revocation. Option B. The task becomes legal because a physician supervised and ordered it. Option C. The MA can perform the task if they feel confident in their ability. Option D. The physician would be solely responsible for any liability since they ordered the task. The correct answer is A. Performing tasks outside the CMA scope of practice violates professional standards and state regulations, regardless of physician orders. CMAs can face disciplinary action from the AAMA, including certification revocation, and may be personally liable for any patient harm. The physician's order does not authorize scope violations. Question 82. A patient has 3 insurance plans: Medicare Part B, a retiree health plan from their former employer, and a Medicare supplemental, Medigap, policy. The patient presents for an outpatient procedure. Which insurance should be billed first according to coordination of benefits rules? Option A. The retiree health plan from the former employer, because it was the patient's first insurance. Option B. The Medicare supplemental, Medigap, policy, because it is designed to fill coverage gaps. Option C, Medicare Part B, because it is primary for retired beneficiaries with employer coverage from a small employer. Option D, all three insurances should be billed simultaneously to ensure fastest payment. The correct answer is C. Coordination of benefits, CB, rules determine billing order based on specific criteria. For Medicare beneficiaries who are retired and have employer coverage, Medicare is primary if the employer has fewer than 20 employees. If the employer has 20 or more employees, the employer plan is primary and Medicare is secondary. The retiree health plan status, active versus retired, and employer size determine the sequence. Medigap policies are always last, tertiary, as they supplement Medicare's payment. Question 83. An 78-year-old patient is being started on a sedative medication for sleep. Which pharmacologic consideration should the medical assistant recognize as particularly important for geriatric patients taking sedatives or hypnotics? Option A, geriatric patients need higher doses for effectiveness. Option B, geriatric patients have increased risk of falls due to slower metabolism and prolonged drug effects. Option C, geriatric patients metabolize sedatives faster than younger adults. Option D, sedatives are contraindicated in all geriatric patients. The correct answer is B. Geriatric patients have altered pharmacokinetics, including decreased hepatic metabolism, reduced renal clearance, and increased body fat percentage. Sedatives and hypnotics have prolonged effects in older adults, leading to daytime sedation, dizziness, and significantly increased fall risk. Lower starting doses and slower titration are standard practice. Question 84. An employee undergoing mandatory drug screening tests positive for marijuana. The employer asks the medical assistant to refer the employee to a substance abuse professional, SAP, for evaluation and potential treatment. The medical assistant is not trained in SAP procedures. What is the correct response? Option A, provide counseling to the employee about substance abuse treatment options. Option B, explain that SAP referrals require specific protocols and training, and route the request to the appropriate qualified personnel or HR department. Option C, refer the employee to a substance abuse professional as requested, since this is within the CMA's role. Option D, inform the employer that marijuana use is legal in some states and refuse to participate in the process. The correct answer is B. Substance Abuse Professional, SAP, referrals for employees returning to work after substance-related violations require specific DOT, Department of Transportation, protocols and trained SAP evaluators. Medical assistants are not trained to make SAP referrals or conduct SAP evaluations. The appropriate response is to recognize this limitation and route the request to qualified personnel, HR, occupational health specialists, or designated SAP coordinators who understand the proper referral process. Question 85. A medical assistant is reviewing the Safety Data Sheet, SDS, for a disinfectant used in the office. Under the GHS system, which section provides critical first aid instructions in case of eye exposure? Option A, Section 8, Exposure Controls and Personal Protection. Option B, Section 6, Accidental Release Measures. Option C, Section 2, Hazard Identification. Option D, Section 4, First Aid Measures. The correct answer is D. Under the Globally Harmonized System, GHS, Section 4 of the SDS contains first aid measures organized by exposure route, inhalation, skin contact, eye contact, ingestion. This section provides immediate response instructions that healthcare workers must know before an exposure occurs. Having SDSs accessible and reviewing relevant sections is an OSHA requirement. Question 86. A patient presents with complaints of fatigue, weight gain, cold intolerance, and constipation. During assessment, the medical assistant notes dry skin and brittle hair. Which endocrine disorder do these findings most likely suggest? Option A, hyperthyroidism. Option B, hypothyroidism. Option C, Cushing's syndrome. Option D, diabetes mellitus. The correct answer is B. The constellation of fatigue, weight gain, cold intolerance, constipation, dry skin, and brittle hair are classic signs of hypothyroidism, underactive thyroid. These symptoms reflect a slowed metabolic rate due to insufficient thyroid hormone production. Question 87. A medical assistant is assisting with medication reconciliation for a patient who was recently hospitalized. The patient's current medication list includes lisinopril 20 mg daily for hypertension, metformin 500 mg twice daily for diabetes, warfarin 5 mg daily for anticoagulation, and a newly prescribed antibiotic for a recent infection. The patient mentions taking ibuprofen 400 mg 3 times daily for knee pain for the past few weeks. Which potential interaction should the medical assistant immediately notify the provider about? Option A. The antibiotic may reduce the effectiveness of warfarin, requiring dose adjustment. Option B. Lisinopril and ibuprofen may reduce blood pressure control effectiveness. Option C. Ibuprofen and warfarin together significantly increase the risk of bleeding and require immediate provider evaluation. Option D. Metformin and ibuprofen have no significant interaction and can be safely taken together. The correct answer is C. NSAIDs, such as ibuprofen, combined with warfarin create a significant and potentially dangerous drug interaction. Both medications affect bleeding. Warfarin inhibits clotting factor production, and NSAIDs inhibit platelet function and can cause GI irritation and ulceration. Together, they substantially increase bleeding risk, including gastrointestinal bleeding. This interaction requires immediate provider notification for evaluation of alternative pain management options and bleeding risk assessment. Question 88. A medical assistant is reviewing an explanation of benefits, EOB, from a commercial payer. The EOB shows that a claim for an office visit, CPT 99214, with an allowed amount of $140 was processed. The patient has a $25 copay for office visits and has already met their annual deductible. The EOB shows a payment of $115. Which interpretation of the EOB is correct? Option A. The claim was denied because the payment amount does not match the allowed amount. Option B. The provider was overpaid by $25 and must refund the insurance company. Option C. The payer correctly paid $115, $140 allowed amount minus $25 patient copay. Option D. The patient owes the entire $140 because the insurance payment was insufficient. The correct answer is C. When a patient has a copay fixed dollar amount per visit type and the deductible is already met, the insurance pays the allowed amount minus the copay. The calculation, $140 allowed amount minus $25 copay equals $115 insurance payment. The patient owes only the $25 copay at the time of service, which should have been collected at check-in. Question 89. The Mental Health Parity and Addiction Equity Act, MHPA, requires health insurance plans to provide coverage for mental health and substance use disorder treatment that is comparable to coverage for Option A. Experimental treatments. Option B. Preventive care services. Option C. medical and surgical benefits. Option D, emergency medical services only. The correct answer is C. The Mental Health Parity and Addiction Equity Act, MHPA, requires that group health plans and health insurance issuers provide coverage for mental health and substance use disorder benefits that is no more restrictive than coverage for medical and surgical benefits. This includes parity in financial requirements, copays, deductibles, and treatment limitations, number of visits, days of coverage. Question 90. A medical assistant posts a photo on her personal social media account showing a patient's unusual skin condition with the caption, "You won't believe what I saw at work today." The patient's face is partially visible. Which legal violation has occurred? Option A, no violation if the MA did not include the patient's name. Option B, defamation because the photo could harm the patient's reputation. Option C, professional boundary violation only, with no legal consequences. Option D, HIPAA privacy rule violation through unauthorized disclosure of PHI. The correct answer is D. Posting patient information on personal social media constitutes a HIPAA privacy rule violation. The patient's condition and partial facial image constitute identifiable health information. Unauthorized disclosure of PHI for non-work purposes is prohibited, regardless of whether the patient's full name was included. Question 91. In the chain of infection, what is the term for the pathway by which a pathogen leaves its reservoir and travels to a susceptible host? Option A, portal of entry. Option B, causative agent. Option C, mode of transmission. Option D, portal of exit. The correct answer is C. The mode of transmission is the mechanism by which a pathogen travels from the reservoir to a susceptible host. This includes direct contact, indirect contact, fomites, droplet transmission, airborne transmission, and vector-borne transmission. Breaking this link is a primary focus of infection control measures. Question 92. The HIT screening tool is used to assess for intimate partner violence. Which four questions does the HITS acronym represent? Option A, harassment, injuries, trauma, stalking. Option B, hurt, ignored, trapped, separated. Option C, harmed, insulted, threatened, screamed at. Option D, hit, intimidated, terrorized, silenced. The correct answer is C. The HITS tool is a brief four-question domestic violence screening instrument. Each letter represents H equals how often does your partner physically hurt you? I equals how often does your partner insult or talk down to you? T equals how often does your partner threaten you with harm? S equals how often does your partner screamed or curse at you? Each item is scored from 1, never, to 5, frequently, with a total score greater than or equal to 10 suggesting intimate partner violence. Question 93. Which three elements must be present on every entry in a patient's medical record to meet documentation authentication standards? Option A, vital signs, chief complaint, and review of systems. Option B, provider name, insurance information, and billing codes. Option C, patient name, diagnosis, and treatment plan. Option D, date, time, and signature or electronic authentication of the person making the entry. The correct answer is D. Medical record authentication standards require that every documentation entry include three essential elements: the date, when the entry was made, the time, specific time of entry, and the signature or electronic authentication of the person making the entry. These elements establish accountability, create a chronological record, and identify who documented each piece of information. Authentication ensures the record's legal validity and supports quality assurance. Question 94. A provider orders arterial blood gas, ABG, analysis for a patient with respiratory distress. The medical assistant understands that ABG collection is typically performed by specialized personnel. Which statement best describes the CMA's role and awareness regarding ABG testing? Option A. CMAs perform ABG collection using standard venipuncture technique with a butterfly needle. Option B. CMAs are prohibited from any involvement in ABG testing, including specimen transport. Option C. CMAs routinely perform arterial blood gas collection as part of standard phlebotomy duties. Option D. CMAs may assist with ABG specimen transport after collection, but typically do not perform arterial puncture. Respiratory therapists or specially trained personnel usually collect ABGs. The correct answer is D. Arterial blood gas collection requires arterial puncture, typically radial artery, which is a specialized procedure performed by respiratory therapists, specially trained nurses, or physicians. CMAs typically do not perform arterial puncture as this is outside standard phlebotomy training. However, CMAs may assist by transporting ABG specimens to the laboratory after collection, maintaining specimen integrity. ABGs require immediate analysis or special handling, and understanding ABG test purposes for patient education support. Question 95. A patient requests that the medical office correct an error in their medical record. According to HIPAA and standard documentation protocols, which action represents the correct process for handling patient record amendment requests? Option A. The provider should reject all amendment requests since medical records are permanent legal documents. Option B. The medical assistant should delete the electronic record entry entirely and create a new entry without documentation of the change. Option C. The patient submits a written request for amendment. The provider reviews and either approves or denies with written explanation. Option D. The medical assistant should erase the incorrect information and write the new information directly over it. The correct answer is C. HIPAA grants patients the right to request amendments to their medical records if they believe the information is inaccurate or incomplete. The patient must submit a written request explaining the proposed amendment and the reason for it. The covered entity must review the request and respond within 60 days, either approving the amendment or providing a written denial with the reason. If approved, the amendment is appended to the record while the original information remains documented. Question 96. A medical assistant is measuring vital signs on a 58-year-old male patient with known congestive heart failure. The patient's blood pressure is 88/56 mm of mercury, pulse is 102 BPM and regular, respiratory rate is 24 per minute with mild dyspnea noted, and pulse oximetry is 92% on room air. The patient states he feels a bit tired today but denies chest pain. Based on these findings, which action represents the correct priority sequence for the medical assistant? Option A. Immediately notify the provider of the vital sign abnormalities before completing full intake, stay with the patient to monitor for worsening symptoms, and prepare crash cart awareness, given the cardiac history. Option B. Increase the patient's oxygen flow rate via nasal cannula to improve SpO2 before the provider arrives. Option C. Complete all intake documentation first, then notify the provider that the patient has abnormal vital signs requiring evaluation. Option D. Place the patient in Trendelenburg position to improve blood pressure, then complete intake and notify the provider. The correct answer is A. The patient's vital signs demonstrate hypotension, 88/56, tachycardia, 102 BPM, elevated respiratory rate, 24 per minute, with dyspnea and borderline oxygen saturation, 92%, in a patient with congestive heart failure. This combination suggests possible cardiac decompensation. The medical assistant must prioritize provider notification immediately, monitor the patient for deterioration, and maintain crash cart awareness, given the cardiac history and unstable presentation. Question 97. A patient tells the medical assistant, "I think my medication might be making me feel weird sometimes." Which response best demonstrates the clarifying technique? Option A, "Don't worry, that's a common side effect that usually goes away." Option B, "That sounds concerning. Tell me more about what you mean by weird." Option C, "Which medication are you referring to?" Option D, "You should discuss this with your physician." The correct answer is B. Clarification is used when patient statements are vague, ambiguous, or unclear. The medical assistant seeks additional information to understand exactly what the patient means before responding. Asking the patient to elaborate on weird helps identify whether the symptom is physical, emotional, or cognitive, which guides appropriate follow-up and documentation. Question 98. A patient with advanced dementia is admitted for a procedure. The patient cannot understand the explanation of risks and benefits, but smiles and says yes when asked about consent. The healthcare proxy designated in the medical power of attorney is unavailable. Which analysis best addresses the capacity issue? Option A. The physician can provide consent as a surrogate since the patient lacks capacity. Option B, capacity is lacking because the patient cannot understand information. Consent must come from the proxy or be delayed until proxy is reached. Option C, consent is unnecessary for patients with dementia because they cannot make medical decisions. Option D, the patient's verbal yes constitutes valid consent, so proceed with the procedure. The correct answer is B. Informed consent requires capacity, ability to understand information, appreciate consequences, and make reasoned choices. Dementia impairing comprehension means the patient lacks capacity despite verbal agreement. The designated healthcare proxy must provide substitute consent. If the proxy is unavailable, the procedure should be delayed for non-urgent situations or facility surrogate consent protocols activated for emergencies. Question 99. A military retiree with TRICARE Prime coverage calls to schedule an appointment with a cardiologist for ongoing cardiac monitoring. The patient asks whether pre-authorization is required for the specialist visit. Which response accurately describes TRICARE Prime authorization requirements for specialist referrals? Option A. TRICARE authorization requirements are the same as Medicare, so follow Medicare referral rules. Option B. TRICARE Prime does not require any authorization for specialist visits, so you can schedule directly with any cardiologist. Option C. TRICARE Prime requires a referral and pre-authorization from your primary care manager, PCM, before seeing a specialist, except for certain exempt services. Option D. You only need authorization if the cardiologist is out of network. In-network specialists require no referral. The correct answer is C. TRICARE Prime operates similarly to an HMO model, requiring enrollees to have a primary care manager, PCM, who coordinates all care. Specialty care typically requires a referral and pre-authorization from the PCM before the beneficiary can see a specialist. Without proper authorization, TRICARE may deny coverage for the specialist visit, and the beneficiary may be responsible for the full cost. Certain services, mental health, substance abuse, and some preventive services, may have exempt authorization rules. Question 100. A medical assistant is explaining the difference between surgical asepsis and medical asepsis to a new employee. Which statement accurately describes the distinction? Option A. Surgical asepsis is used for routine patient care. Medical asepsis is used for invasive procedures. Option B. Surgical asepsis reduces the number of pathogens. Medical asepsis eliminates all microorganisms. Option C. Surgical asepsis requires hand washing only. Medical asepsis requires sterile gloves and equipment. Option D. Surgical asepsis eliminates all microorganisms including spores. Medical asepsis reduces pathogen transmission. The correct answer is D. Surgical asepsis, sterile technique, aims to eliminate all microorganisms, including bacterial spores, from an area. It is used for invasive procedures, surgery, and when entering sterile body cavities. Medical asepsis, clean technique, aims to reduce the number and transmission of pathogens through practices like hand washing, PPE use, and environmental cleaning. It is used for routine patient care activities.